Cannula insertion. Intravenous. 4. Insertion is a medical procedure used to deliver medication or fluid directly into the bloodstream via a needle-like tube called a cannula. 4 cannulas are available in a variety of sizes, which are often differentiated by color. The necessary cannula size is determined by assessing patient characteristics and the clinical situation before inserting the 4. The skin over the insertion site is thoroughly cleaned using antiseptic. After locating the correct vein, the needle tip is inserted at an approximately 15 to 30 degrees angle. Lowering the cannula. After insertion, the 4 cannula can be lowered closer to the surface of the skin to ensure accurate penetration of the vein. First flashback. When the cannula's needle-like tip pierces the vein, blood will appear in the clear external chamber. The sudden appearance of blood is called the first flashback, and signals the cannula is properly inserted into the vein. Cannula advancement. The chamber containing blood from the first flashback stays in place while the cannula needle advances about 1 centimeter further into the vein. Second flashback. Blood further accumulates in the clear external chamber during the second flashback event, while the cannula needle is fully advanced into the vein. Needle withdrawal. When the procedure is complete, the components of the 4 cannula are carefully separated and withdrawn from the vein. The catheter hub is capped. Proper disposal of the needle into the Sharps container helps prevent injury and infection.